Oops, something just fell out of the
That's okay.
Okay.
So everybody, this is Trish Meyer and Ann Kramer, who
Hello.
are going to be giving the talk today. So let's give them a warm welcome. Thank you.
Sure. I'll start out, yeah. Good morning.
Morning.
So as Nina said, I'm Trish Meyer, and I work at the University of Michigan Depression Center. I oversee their education programs. And the University of Michigan Depression Center is part of the health system here at the university, similar to the Cancer Center or the Cardiovascular Center, but we focus on depression, bipolar disorder, anxiety disorder, and other depressive illnesses. And the Depression Center was the very first of its kind in the United States. It was founded here at University of Michigan. The Depression Center's mission includes treatment of depressive illnesses, as well as research, public policy, and advocacy, and also education programs to help raise awareness about depression, let people know that effective treatments are available, and also help to reduce the stigma or negative feelings that people sometimes have about depression, which can often be a barrier to getting treatment that can be very helpful. So the reason that Ann and I are here today is because, as all of you are well aware, college and graduate school can be a very stressful experience. And I'm sure that all of you have experienced some kind of stress or maybe even distress in the past few months, and probably will in the next coming months, and that's normal, and that's to be expected. But sometimes when the stress doesn't go away or keeps going or gets worse, it can be something that might trigger or lead into a more serious condition, such as clinical depression or an anxiety disorder. And so while with just kind of regular stress, usually you can manage it maybe by exercising or doing meditation or yoga or whatever works for you to help relieve those stressful feelings, and then the stress goes away. But in a situation where it triggers a more serious condition like depression or anxiety, those coping mechanisms alone are not enough, and professional support or treatment with a psychologist or psychiatrist or social worker is needed to help you get the support you need to feel better. And the good news is that here at the University of Michigan, there are lots of resources, lots of services that can help students who might be suffering from depression or anxiety. The bad news is that oftentimes students might not recognize that what they're experiencing is an illness. They might feel like this is something they should just be able to get over on their own, or they might have feelings of shame or embarrassment, or somehow feel like this is something they did to themselves, and so they don't seek the treatment that can be so helpful. When in fact depression is an illness, just like diabetes or asthma or cancer, and it's something that can be treated and people can feel better. So our goal today is to give you some information about depression and anxiety so that you will be able to better recognize if someone you know or a friend or maybe even yourself might be suffering with depression or anxiety. And then we'll also tell you about all of the different resources here on the U of M campus that can help to support students who have depression or anxiety. So first, I'm going to turn it over to Ann Kramer, who is a clinical social worker in the Department of Psychiatry at the Depression Center, and she'll give you some of this information about depression and anxiety.
Thank you. So being in college and being in graduate school, as Trish said, is a time of significant stress. But even more so for graduate students who are balancing some life responsibilities, family responsibilities, and academics at the same time, for some working, that adds to the stress. For some people who experience stress, they might feel sad or overwhelmed or irritated or uncomfortable and have a difficult time. But when the stress goes away, those symptoms go away. For others who maybe have a more serious problem, when the stressor goes away, they still have the symptoms. And that's what we're talking about. So we're talking about mental health problems, mental health disorders, anxiety, and depression. So these are not just a bad day or a bad mood. or feeling stressed out. It's more than that. We're talking about something that's going on internally, chemical imbalances that are actually happening in the brain. We can actually see an image of the brain of someone who has depression and compare it to someone who doesn't have depression and visually see differences. So we know there is chemical activity going on for people who are struggling with depression. It's not a sign of weakness, and yet people who are suffering feel like it is. They're afraid they're being weak because they feel down, or they don't have the ability to manage their life because they have depression. So I want to share with you a little information about depression and about graduate students. So we know that it's a big problem among college students and graduate students. So for most people, the onset of depression starts during late adolescence, young adulthood. So that's the age of college students and graduate students. So for some people, they come here to school already having been diagnosed with depression. For other people, they come here and recognize maybe they've been having symptoms for a long time, and they get the diagnosis here from one of the services they go to get the help that they need. And Trish will talk to you about some of those resources. So there have been surveys done here at the University of Michigan and nationally asking students if they have symptoms of depression. And here's what they found out is about here at University of Michigan, 23% of graduate students have reported symptoms of clinical depression. And it's a little bit higher among the international graduate students. The problem is that less than 50% of people with depression and mental health problems get the help they need. So we have people out there with these symptoms who are not getting any help. What happens for people experiencing depression and anxiety who don't get the help they need, the symptoms get worse, and the episodes may be more serious and more frequent, and that can result in worsening problems, and in some cases tragedy, even suicide. So the most important thing to do is to be able to recognize symptoms of depression and get the help as early as possible. So what are the symptoms of depression? What do you know about depression? What have you learned or heard? Symptoms you may know about. Anyone learn any information about symptoms of depression?
Don't be shy. They're usually not shy.
Losing energy,
Right. Losing energy, not having energy.
and not willing to do something.
Right, exactly. It's difficult to find the motivation to do something for some people who have depression. Exactly. What else?
Easy to be angry.
Easily angered or irritated or grouchy, especially for adolescents and older adolescents and young adults. They get very irritable and angry. What else?
You don't feel satisfied with yourself or with the things you do.
Exactly. So they, even if someone is doing well, if they have depression, they may not feel like they're doing well. They may not enjoy the things that they used to enjoy. Other symptoms you know about? So this topic is familiar to some of you. You have some of this information. Let me share a little bit more. Okay? So for some people, they'll have trouble with their appetite. Maybe they don't feel hungry. Or maybe they're not enjoying eating. Or they eat a lot and gain weight. So for some people who have depression, there's a weight gain or a weight loss over a period of time. It's very common for people with depression to have trouble with sleep. So Maybe they can't fall asleep easily at night, so they're awake at night, worrying. And if you ever wake up in the middle of the night, it always seems that all of the problems are worse in the middle of the night. Start to worry. Or for some people, they sleep all of the time. They do their work, come to class, come home and sleep. Right? Wake up to eat dinner, go back to sleep. So that's a problem. Some people feel restless. Agitated is a word for restless. They're just uncomfortable feeling the way they're feeling. Other people have difficulty concentrating. That's really difficult for a college student or a graduate student to be in this high-pressure University of Michigan and have difficulty concentrating. So those are some of the symptoms. So anxiety is a little bit different. There's some similarities, but when we diagnose someone with anxiety, we might see some of these things. Someone who worries so much that they just can't stop worrying, even if there's not something to be worried about. So they might be so worried about something that maybe they avoid doing something. For example, someone might be so worried about doing well academically in their classes that they may become so overwhelmed they avoid even going to class. So it becomes a problem. Or someone might feel so uncomfortable in social situations that they avoid social situations. And then they get more isolated and more worried and avoid even more. So it's this cycle. Maybe I should stand over here because I think I'm in the way. So other people who have anxiety might get very panicky if they're around a lot of people. If they're up high, they might have a phobia about one of those things. My husband has a phobia of heights, so we can't ever drive any place very high up, so it gets very panicky. Some people have what's called obsessive compulsive disorder. They have to repeat certain things to feel okay, or have to have things in a certain place, or have to wash their hands. They have a fear of germs, for example. Other people who have experienced something traumatic, like exposure to war or violence or attacks, might have repeated nightmares or flashbacks. So that's anxiety. Some people struggling with depression or anxiety will use alcohol or drugs as a way to try to feel better or more relaxed. The problem is that makes the depression and the anxiety worse. Chemically, it makes it worse. For some people who have depression, their behavior may be riskier. They may be a little bit more impulsive. And so they may drink as part of that being impulsive. So it becomes very difficult to treat the depression when someone is also using drugs and alcohol. I lost my triangle, but if you can picture a triangle, okay. What happens is, for someone who has depression, they might have an experience and they can't perceive things accurately. So for example, if I am depressed and I walk into this room and you're all laughing, I might think you're laughing at me, when in fact you're not, right? So I might feel very sad or very lonely about that. I might isolate myself or withdraw from people because I can't perceive their actions very well. Another example might be if I'm depressed and I don't do well on an exam. I might think, I will never do well on an exam. I will never pass my graduate program. I will fail. If I fail, I can never return home to my family. I could never face my friends and family. I will never get a job. Just this on negative thinking, and it's difficult to stop. So when we help people who are struggling with depression, we help them with this way of thinking and try to help them think more positively. So, as I'm sharing these symptoms with you, we're talking about symptoms, you may be thinking, I know someone who is experiencing those symptoms. I don't have energy. Sometimes I feel stressed or sad or lonely. As a graduate international student, I feel lonely. I might feel lonely because I miss my family and my home. I feel pressured. Maybe you're the only one in the United States. Maybe there's pressure to succeed academically here at the University of Michigan. That's a lot of pressure. Does that mean you have depression or anxiety? Maybe not. What we do to determine if someone has depression or anxiety is we take a look at how they're functioning. How are you doing in the main areas of your life? Your main responsibilities are to take care of yourself, to be responsible within your relationships, and to focus on your academics. So if we see a problem in one of these areas, that tells us those symptoms are getting in the way of your functioning, and it may be depression or anxiety. Any questions about that or what I've said? Sometimes it gets so bad that someone feels so hopeless that they have thoughts of suicide. So when someone is feeling hopeless or desperate that things won't get better, or they're very, very anxious or very, very angry, they may be at heightened risk for suicide. Or if someone is using drugs or alcohol. For people who are impulsive, when they use drugs or alcohol, that will increase their impulsive behavior. And if they're thinking about suicide, they may act on those thoughts. The good news is, as Trish mentioned, there is good help available for people who have mental health problems. There's research about this. We know that people who get better sleep do better academically and do better emotionally. It seems very simple. But when you're working and managing a difficult academic load, it's difficult to find the time to get enough sleep. Right? With everything else you're doing, you may sleep fewer hours. But if people have a regular pattern of sleep, they're less likely to experience some of the symptoms we're talking about. Exercise, there's also research about exercise. For some people, just getting out and walking or doing yoga or swimming or something active will actually chemically impact them and impact their mood. So there's different coping strategies. Trish is going to share with you resources where there's opportunities to learn more of these coping strategies. It's helpful to get education about depression and anxiety. If you were diagnosed with diabetes, for example, you would learn about your illness, your disease. You would learn about the medication you have to take. And it's the same thing with depression, which is a medical illness. There is support here on campus, and there are opportunities for someone to have an academic plan to help while they get the treatment they need. So that includes working with an advisor or a professor. Many of the professors here on campus are trained, get some information about resources and how to help students who may be struggling with their mental health. The Graduate Student Affairs Office has support. The bottom line is that the administrators and the teaching staff at the University of Michigan want graduate students to succeed. They have an investment as well. So they will really help students to adjust what they need to adjust to do better. Research tells us that the best treatment for people with depression and anxiety is what's called combination treatment, medication and therapy. And the therapy doesn't have to be very long. Maybe just meeting with someone a few times to learn some of these strategies. I mentioned that many people don't seek help for their depression or anxiety. So students tell us they worry what other people will think. What will my family think? My culture doesn't believe in mental health problems. In my family back home, we don't talk about those things. So it becomes much more difficult to be here in the United States. But here in the United States, we've made changes and we talk more about these things. It's still uncomfortable, but people get such relief when they get the help they need for these problems. Sometimes students will say, this is normal. I'm a graduate student. I'm just going through what everybody else is going through. But if it's getting in the way of sleep and appetite and feeling good, then it's a problem. Okay? Some people will say they don't have the time. So Trish will share with you some resources available with flexible schedules. Some people believe the problem will get better on its own. If someone has depression or anxiety, it doesn't get better on its own. So, I'm going to skip that for now. So what we encourage you to do is to notice how you feel, to notice any changes in yourself. If you or someone you know is experiencing the symptoms that I've talked about, to pay attention to how long they've experienced the symptoms, how long in a day or how many weeks, and how they're functioning. Someone could have depression and do very well on their academics. So they still, it makes it difficult to know if someone has depression if they're doing well, but they may not be doing well in another area of their life, like their relationships or caring for themselves. So pay attention to that. We view getting help as a sign of strength. It's very difficult for people to convince themselves of this, but when we talk to people who went ahead and got help, they're so relieved. Their life really changes. So we encourage people to get help or to reach out to someone else and encourage them to get help. So if you notice someone else struggling, it's okay to just ask them, what's going on? I notice you seem tired. You seem upset. You seem withdrawn. And point out what you notice. For someone who has depression, if someone else notices, that is very, very helpful. And if you're willing to talk to someone, then it makes it okay for them to talk about it. It takes away the stigma, right? So reach out to someone else if you notice. And then if they say nothing, it's none of your business, you're too busy, try again and say, I'm concerned about you. I know where you can get some help. And then the next step would be to link someone to some of the resources you'll hear about from Trish. So my take-home points for you is that mental health disorders are medical illnesses and are very treatable, but often they go unrecognized. It's really important to take care of yourself. We know healthy interventions work. And even though it may be difficult to talk with family and friends, they are the best supports for people who are struggling with these symptoms. Even sitting here and listening to us talk about this, to be willing to listen to this, is one step in combating stigma about mental health. So I'll stop there.
Can
we want to.
Do you want, yeah, does anyone have any questions? That was a lot of information.
I'm just curious.
Yes.
You know, you showed the slide of it, kind of a, you know, the arrows, you know, circling.
Mhm.
I'm just curious, what was that? It seems like a recycling or
Well,
reinforcing.
so, that's a very good question. So what happens is if someone has depression and then they drink alcohol as a way to cope with their depression, it makes the depression worse, and then it becomes more difficult to treat the depression. And so then they might drink more, and it's a cycle, and it's very difficult to stop that cycle. So that represents this
Negative feedback loop.
Right.
Right, a cycle, a negative cycle, exactly. Someone else had a question? No? Okay.
Okay, well, we can take more questions too at the end. But maybe I'll just sit here since I'm going to be showing the website. So,
Now, how do I get to the website?
as I said before, you know, the information that Anne presented can be a little overwhelming or daunting, but the good news is that really the University of Michigan has a lot of great resources that are available to undergraduate and graduate students to help support your mental health. And the difficult thing actually is because there are so many resources, sometimes it can be hard and sort of overwhelming to find what you need for your particular symptoms or your particular situation. So to address this, in 2009, the Depression Center created a website called Campus MindWorks, and we've got little cards here that have information and has the URL so you can take a look at it on your own later. But the goal of this website was to bring together all of the resources from the University of Michigan, as well as in the, you know, the whole community of Ann Arbor, and put them in one easy-to-search database. So you can find whatever support service you need. All of the information is on this one website, rather than having to go to all the different websites that exist within U of M. And in addition to the resources, we also have information about managing your mental health within the unique environment of college, undergraduate, or graduate school, because it's a different kind of a situation and there's different pressures. So all of the information here is tailored specifically for University of Michigan students. So I'm just going to show you a few things here, just to give you a little overview of the website. And as I said, hopefully you can explore it more on your own. So you can't see the whole screen, is that okay? It's okay. We'll do our best. Let's see. Wait,
I
something.
think we could make it smaller.
All right, something funky just happened there. I don't know why that's happening.
Oh, I don't either.
I think you clicked on something.
I clicked on something and I still
Oh, dear.
Just click again.
click again. Oops.
Why is that doing that?
I don't know.
I'm just,
It's like some graphic that went awry.
I think you,
I dragged it.
yeah.
Pretty
It's
big.
really weird that you should be.
I don't know.
That's
what's
never.
going on. Oh, boy.
Should we exit and start again? Oh, you got rid of. Oh, no.
Well, should I start again?
Maybe just
completely?
X out of there.
Okay.
And then let's try again. Oh, yeah.
How weird. I'm sorry.
No, it's not your fault.
No. We'll try it again.
All right. And if not, I'll just talk through it. That thing
It's
is
still
up
there.
That is very weird.
Mm.
Rats.
Let me try maybe one of these ones. And now,
It's probably frozen up your.
this is really weird that that's
That's
still
very
there.
weird.
Try to move it to the trash. I'm sorry.
No,
I don't know what to do.
I feel like our website, like something's wrong with it. That it. Should I just kind of talk through it?
Maybe.
Yeah.
I'm sorry.
No, that's okay.
I'm gonna work on it for you.
So it's sort of hard to describe, but
I'm going to unplug this in the interim.
okay.
I'll work
So,
on it
okay.
next time.
if you are on the website, you can see on the top bar, there's several different categories, and the one that says resources is probably the most important one, because that's the one that you click on, and you can search all of the resources at U of M and in Ann Arbor. And there's a couple different ways to do it. You'll see, you can either search by the kind of disorder that you're interested in learning more about. So click on anxiety disorders, and it will come up with all of the services at U of M that help to treat anxiety disorders, as well as some websites, other websites that are helpful, and also a list of books that might be helpful. So you can search that way, just by the topic. You can also search by the type of services that you're looking for. So for example, if you're looking for counseling and treatment, click on that, and it'll show you all of the counseling and treatment services. If you're looking for emergency services, somebody who is in a crisis and needs support right away, click on that. There's also support groups. So if you're looking, instead of for individual counseling, but you want to be with a group of other people who are facing similar challenges, you can search under that as well. And then finally, there's something called advanced search. And when you click on that, you'll see lots of different little boxes. And this one can really help to focus on exactly the place that you need to go and the type of treatment that you're looking for. So maybe you click on anxiety disorders, and you want someone who accepts grad care, or whatever the insurance is. I don't know what the graduate student insurance is. And you want it in walking distance from campus, and you want counseling and treatment. So you click on the different things that you're looking for, and it will come up with a list of those few services. So again, we're really trying to narrow it down and make it easier for you to find exactly what you need. Now, I don't know if you've heard about CAPS, Counseling and Psychological Services. Have you learned about that? So Counseling and Psychological Services is the U of M mental health services for all students. It's free for all students. It's located in the Michigan Union on State Street on the 3rd floor. So that's probably the first place that you should go or call. And we actually have cards here too that have the phone numbers for counseling and psychological services on it as well. But if you're just looking to get a medication refill, for example, then CAPS is not the place you would go. You would go to University Health Service, which is the main health, kind of overall physical and mental health service for all students. So the point is that that's what that advanced search tries to do, is help you narrow down where to go for your particular needs. But for most things, I would recommend go to CAPS, then they will help you to figure out as well what the best place is for you. Look at that.
I'll sort of help you.
Okay, if you just go to find resources, just maybe just show them.
Yep.
So again, this is what I was talking about, where you can search by disorder, and then if you scroll down, can you just scroll down? There's the little advanced search button. Maybe click on that, and I can just show them. So then here again, you can click off which box, what you're looking for, and then treatment. And then can you just scroll over to the right, so I can show them the community provider database. Whoops. It's not going. Oh, there it is.
Okay.
And so this actually is another database that's attached to this. That has clinicians, doctors who are working in Ann Arbor who are not necessarily affiliated with the University of Michigan. So if you're someone who has a diagnosis and you know you're going to be needing longer term treatment, that's a great way to find somebody. Again, you can search by male, female, whatever characteristics you're looking for in a clinician, because CAPS only offers a certain number of appointments. It's for short-term counseling. And so the community provider database can help you find a clinician who will be for longer term, maybe the whole time you're here in Ann Arbor. Okay, so next, can you go back over to see the sidebar on the other side? Oh.
Bizarre.
Get it back to the home page.
Oh, yeah, no problem.
Ah! Oh, here we go. So as you see on this side, it's divided by the audience. So obviously, we would be most interested in the student section.
Can we click on it?
My assistant, Anne, will. And when you click on students and when it works,
It
you
always
find-
works.
yeah.
It's Nita's computer.
You'll see that it's broken up into different categories. So there's something about preparing to come to college, self-care when you get here, academic support, so all different categories. And there's also a section called Student Spotlights. And that might be of interest because under there we've got a whole spotlight on international students. And so there's information there about the International Center, which is also located in the Michigan Union. There's information about managing academic pressure, adjusting to a new culture, and also information about mental health support services. So if you, clicking on that student bar is a good place to go. If you go down further, you'll see there's information for parents as well, talking about the different services at U of M. And then, if you keep going down, it's frozen. Wacky. There's a bar that says tools and checklists. And under tools and checklists are some of the self-care strategies that Ann talked about. So it's got information about relaxation techniques, tips for managing stress, as well as things that can help you to keep track of how you're feeling. Like Ann was talking about noticing your feelings, noticing symptoms. We actually have a notebook that we put together that has all of those tools and checklists that we printed out into a hard copy, and I have copies here if anybody's interested.
Where's that
But
one, Trish?
under tools and checklists, let's keep going down, right there. I don't know if it'll, yeah. So again, it's got lots of different things that you can click, and it'll help you to, look at how to choose a therapist, what to prepare for your first appointment. Here, it's got different worksheets, like a journaling tool where you write down how you're feeling, symptom trackers to keep track of different symptoms you may be experiencing. And again, so as you can see, we've got this is a self-care log. So you keep track of, what you've been eating, your exercise, your sleep, all of the things that can impact your mental health. So these are just kind of helpful. Some people like to do it online, but we also heard from some students that they prefer to have it already written out for them so they can use it. So we have both ways of accessing those forms. So if anybody wants one of these notebooks, I've got a few here, or you can also just download the forms online. So I hope that you'll take some time to look at the website on your own on a computer that works a little better. But the last thing I wanted to tell you about were some support groups that we started for students that take place in classrooms. So they're not at CAPS, they're not at the Department of Psychiatry, they're not in a clinic, but it's just a very informal setting. They're called the Campus MyWork support groups, and we've got flyers about them here. They start in October, so they're free, they're drop-in, you don't need to register. We have them on North Campus, up in the Chrysler building. So if any of you are in the College of Engineering or School of Music, Theater, and Dance, or Art and Architecture, that's up on North Campus, the second Tuesday of the month. And then we also have them here in Angel Hall, which is the big main building on State Street, across from the Michigan Union, in a classroom at Angel Hall, and that's in the fourth Tuesday of every month. And so it's an hour and a half. We have food for dinner because it starts at 5:30. And basically, it's a chance to hear more information. We start with a brief presentation just about different topics that might impact mental health. So we have ideas about strategies for managing stress, strategies for improving relationships, the impact of sleep and exercise and other factors that can impact your mental health. That's the first half. And then the second half is a facilitated support group. So we have a nurse from the Department of Psychiatry who runs the group. And again, it's just a chance to talk about things that you might be struggling with, meet other students that might be facing similar challenges. It's all confidential, but it's just kind of nice to hear what other people are going through, maybe some of their strategies that have been helpful, and just know that you're not alone, and there's other folks that are struggling with similar things, and it can be very helpful to get that support. It's not a replacement for seeing a therapist or seeing a clinician, because that's very important. But it's just another way to get a little bit of additional support during the month. So again, those start in October. I hope you take a flyer and you can get more information. We always have the schedule on the website, and it lists what topics we're going to be covering too. So you can see if there's something that's really of interest to you. Even if you don't stay for the support group, you can still come and hear the educational presentation at the beginning of the group. So it's very informal, very relaxed setting. And I also printed out some other information here. I hope you'll come and take a look. Other support groups that we have out at the Depression Center, which is out in East Ann Arbor, so it's kind of far away. It's at Plymouth and Earhart Roads. But I do have information about those groups. But the reason we started the groups on campus was to make it obviously easier for students to get to them. I also printed out a sheet that has a little bit, it's sort of a snapshot of the information that's on the website in terms of different mental health resources on campus. So you can take that, and then just general information, as well as this little card with emergency phone numbers and the CAPS phone number. So that's my spiel. So we'd love to take any other questions you might have, or thoughts, concerns.
University of Michigan offers some yoga classes in the campus, or just going to schools out of the university?
I know that the CCRB, which stands for the Central Campus Recreation Building, are you familiar with that building? They do offer yoga classes. They offer lots of different exercise classes, and we link to them on here. But if you just, what's that?
The Y has a student rate.
Oh, and the Y, which is
YMCA.
downtown, the YMCA. And there is a fee for the classes, but it's not too high for at the CCRB. I know. So yoga, they do, lots of yoga, other kinds of exercise, Pilates, different kinds of dance, Zumba.
Yoga is really good for mental health.
Yeah.
I have another question. During the winter, how to avoid to get depressed?
Right.
Because the weather is quite cold.
Yeah.
And maybe you can do many activities outside. So how to avoid to get
And actually, in that International Student Spotlight section, we talk about adjusting to the weather in Michigan, because part of the problem is it's not sunny. And the sunlight is really helpful, actually. Just walking outside in the sun can really help to improve your mood. So sometimes people get something called seasonal affective disorder, which is just sort of seasonal depression, really. And Anne can talk more about this, but some things that have shown to be helpful for that is continuing to exercise, even if it's indoors. But also there are light boxes. I don't know if you're familiar. They're specialized boxes that can give light that sort of replicates sunlight. And actually over at CAPS on the 3rd floor of the Michigan Union, they've got a room there called the Wellness Zone. And they have a massage chair, and they've got all kinds of things. And they have light boxes there. So you could actually go in and, I don't know, it's like 10, 15 minutes that you might be able to talk more about how the therapy works.
They can recommend what light to purchase.
Right.
So people will purchase the special light bulb that gives you that similar light that's helpful for mood.
And most people, it's best, I've heard, for most people to do it in the morning, because if you do it too close to bedtime, it can kind of get you wound up, and then it's hard to sleep. But for a lot of people, 15, 20 minutes with the light in the morning can really help. So that's something to talk to a clinician about, but I think if you want to just try it out and see if it's helpful, go over to CAPS, and ask if you can use the light. But definitely trying to stay active, even though it's hard, trying to stay active in the winter is really important. And whenever you can, just getting outside for a walk, even a 20-minute walk can make a big difference.
Getting the right clothing.
Yes.
So that you can be outside.
Right, getting warm clothes, yeah.
The other thing, not related to the light outside, but sleep, there's research about screen time.
Oh,
So
right.
actually, the impact of the light on computers and smartphones before you go to sleep. So the recommendation is to put that aside, what is it, at least an hour
yeah.
before you want to fall asleep, and that will make a difference.
Because if you're looking at your computer right up to the time where you're trying to fall asleep, it's the light is keeping your brain, it's not giving your brain the time to kind of start to go into that sleep mode. And dim lights kind of triggers that, oh, it's time for my brain to start getting ready for sleep. So doing something relaxing, maybe listening to relaxing music, having dim lights right before you go to sleep is really helpful.
Do you have any interpretation services for international students? guess as for international students, this kind of mental things, difficult to explain,
Right.
even in their own languages,
Right,
So
right.
I guess it will be very, helpful for you to have this kind of interpreters or some.
And I know, check with the International Center if they have interpreters, but I know that there are, the health system does have interpreters, so at the hospital and the Department of Psychiatry. At CAPS, I know they have therapists with a large range of ethnic backgrounds. I'm not sure if they have interpreters there, but I think the International Center should be able to find that, someone who could maybe accompany you to the appointment and help with translation.
I personally know several interpreters for some reason, one from Serbia and one from Taiwan. So I know they're there and they go to all kinds of medical appointments.
You said the number of graduate students who have a mental related program is 23%. Is it higher than other universities?
The University of Michigan, I think that's probably
about average,
within
yeah.
the norm, the same range, yeah. But that's what's reported. So
Right.
not everybody will report if they're experiencing, so it might be higher.
Right.
Yeah.
So can I ask you a related question?
Mhm.
If you know, could you give me an example of international comparison of that rate of university?
You mean universities in other countries
Yeah.
compared to here?
Yeah. You said it's kind of like the same in the States, right?
Right,
23%,
yeah,
right.
and international
Right.
students is 30, right?
Mm-hmm.
It's kind of like maybe American standard, right?
That's an American college,
Right.
a survey of American schools.
Yeah, so
Yeah.
if you have any other countries example, I would like to know.
That's a good, I don't know that off the top of my head, but I could try to find out. There's someone, Dr. Daniel Eisenberg is at the School of Public Health, and he runs a program called the Healthy Minds Study. And so he surveys colleges all over the US, and that's where we got this data. And then he uses the data to help the universities create programs to better support their students, depending on what they find out about their population. But he would probably know about international statistics, so I can find out and I could send it to Nina, and she could share it with you.
And may I ask one more?
Sure.
I'm interested about the reason of depression of 23% students because it is said like I'm from Japan. In my country, some of the pressure to get the job hunting is huge, But in your explanation, I thought that the pressure is kind of related to academic pressure, or like an environment, changing environment from the original country. So what kind of pressures does 23% student feel?
I don't know the research, but what we know is that for some people, they are genetically predisposed to have depression. So for some, they may have a parent or a grandparent who has depression, so it's genetic. But for some people, it can be anything that they feel, from their perspective, they feel pressured about. It could be someone is the oldest in a family, and there's pressure on them to take care of the younger siblings and make sure everything's okay. For someone else, it might be having been exposed to something particularly traumatic. For someone else, it may be poverty that contributes. So there's all kinds of reasons, and some has to do with someone's perception of the situation and what it means to them to go through the pressure or a difficult circumstance. So it's individualized in a sense. There's many reasons why people might be struggling. So in many cases, it's the combination of biology and environment, as well as does someone have good coping skills? Does someone have good supports, or are they isolated? So all of these factors contribute.
Okay,
Yeah.
thank you.
Does that answer your question?
Yeah,
surveys of the college students. There may be certain universities where students feel more pressure, or certain types of students. I don't know that information.
But
It's a bad answer.
I think the economy and now that, you know, in the US and elsewhere, there's been economic difficulties, I think that definitely contributes, both because some people might feel even more pressure, like my parents are spending this money or I'm spending this money to go to college. There's a lot of pressure now that I really need to find a job right away, but yet there aren't as many jobs. So I think that that can definitely contribute, because as Ann said, it's really more if you're predisposed, if you're genetically vulnerable, or because you've been exposed to trauma or whatever the other reasons that Ann mentioned, if you're kind of predisposed to possibly developing depression, then those stressors might trigger that depression. Whereas other people might experience the exact same pressures, but for them, it doesn't have that same effect. So, yeah, I don't know if that, it's
Okay, thank you.
hard to know the exact causes.
I think even for normal people who don't have depression or anxiety, it is important to be positive and to have the good mental health to perform well in academic. So I think there's some kind of strategy to being motivated and being enthusiastic about what they are doing.
And I think that's a really good point, that everybody needs to take care of your mental health. And so the strategies that are on the website and in that notebook are good for everybody, even if you don't have a diagnosis, because everyone experiences stress. And how you respond to that stress makes a big difference. And so taking care, you know, exercising, again, sleep, having, you know, trying to change negative thinking, those patterns is important for everyone. Yeah, and it can help you to feel better and be better able to perform the best that you can and to be successful.
We call that mental wellness, and some of the things that you do to be mentally well are prevention. It's preventing the onset of depression and other problems.
So related to the previous question, so I think it is difficult to distinguish so whether this feeling is just feeling or
Right.
symptom of mental health disorder. So what is the point to distinguish a certain symptom?
So what we want to know we want to know what symptoms someone is experiencing, and we want to know how long. And typically, if someone is experiencing several of those symptoms, usually maybe 3 or 5 symptoms, for 2 weeks or longer, that might confirm a diagnosis of depression. So if you have a bad day, or even a bad few days, but then you're doing fine, that probably isn't depression. If it goes on, or it's a good part of the day, then that's different. That could be depression. And if you're having trouble functioning in one of those main areas of your life, or if it's a big change. So you had energy, you were doing well, you were feeling good about yourself, and it's a big change. We might also use that to determine whether it might be depression.
So, but I think the point is, if you are concerned or if you're wondering, go look for some help and see, because somebody could just help you to maybe think, no, you know what, it's not depression, but it sounds like you're struggling with these things, and here are some strategies that can help. So the thing that is so tragic, I think, is that people go for months just feeling so terrible, not doing as well as they could be, not enjoying being at the university. That's not normal, and it's frustrating, you know, for us. The reason we come out and do presentations like this, we just want people to know that you can feel better, and the treatment really does work. So if you're concerned, it doesn't hurt to go and talk to somebody and just find out, And then maybe they say, well, it's not depression, but maybe you could benefit from this group that we run for, time management, to help you better manage your time, because that seems like something that's stressing you out. They can help you figure out what might be helpful. Yeah, sure.
You mentioned that there's a gene cause depression. There's a gene.
Wait, I'm sorry.
Oh, that there's a gene?
Yes,
Oh, right.
I just wonder which part of the gene
Yeah.
causes the depression.
So, we don't have the scientist with us
Yeah.
here, but, there are researchers doing work on that. I don't know.
At this point, I don't know if they've identified what gene causes depression yet, but they are doing that research. But they know that there is a genetic component to depression. So when someone comes in for treatment, they'll often ask, do you have a parent or an aunt or, or a grandparent who has had depression? Because then that can also help them to understand what might be going on with that individual. But it definitely has a genetic component. But again, just because your mother has depression doesn't mean that you will get depression. It just might mean you might be more vulnerable, depending on your circumstances. So it's not an exact science in that sense,
But
which
there's-
is what makes it so challenging.
There's all kinds of research going
Yeah.
on where they're trying to identify biomarkers, and they're doing saliva tests and blood tests, but it will be a while.
Did you have a question?
I know, we know there's a cultural difference between different countries. So maybe American doctors can easily understand American people, but it may be difficult, a little difficult to understand the international students. So I'm wondering why it's more difficult for American doctors to deal with the depression of international students.
The psychiatrists are, I think, are very well trained in understanding depression across all people. But for the specific cultures, some people have a better understanding than others. And that's why it would be helpful to ask about those resources. For example, at the Department of Psychiatry or at the Depression Center. We have, our staff in the Department of Psychiatry is quite diverse. So we have psychiatrists and residents from all different countries.
And at CAPS as well, they have therapists from a wide variety of ethnic and cultural backgrounds. So if you would prefer, you feel like it would be better to have a counselor who's either from your country or understands your culture, definitely let them know, and they can make that happen. So, because you're right, there are a lot of cultural differences in terms of how people even talk about depression, how the treatment, what they feel comfortable with, and so that's very important. And I think that actually sometimes that's why people don't seek treatment, because they think they won't understand, they don't understand, how I'm feeling, and don't let that be a barrier, I think, because there's a pretty large staff of people. And if, again, in addition to CAPS, there's the psychological clinic, which is over on Washington Street, and they actually treat a lot of graduate students there as well. And again, very diverse staff. So I think you hopefully would be able to find someone you would feel comfortable with.
And it's not just the doctors, but the social workers are also well-trained in being able to work with a diverse group of individuals. And they have, here it's in the United States, especially here at the university, the social work and medical staff are very well linked. They collaborate quite a bit. So.
You have mentioned that there are 30% of international students are under reported they are under such disorders. Does that include graduate and undergraduate students?
That 30% was graduate students, and actually we have the information that even divides it by year, I think, and by the program they're in. I didn't include that, but we have that data. Engineering versus, I think the highest was actually humanities when I took a look at it, which I thought was interesting. I wouldn't have expected that, but yeah. You guys think that makes sense? I didn't.
Which
Yeah.
is higher compared to natural science and the
I don't know.
We can send those slides,
Yeah.
again, we'll send those
Yeah,
slides
I
to
don't-
Nina, because
I-
we have that. We just,
I
it was
have
interesting for us, because usually we give this presentation to undergraduate students, and so when Nina asked us to come, we got some information about graduate students, which was new, you know, it was new information for us too, because I think it's really important, and I'm actually, you know, this coming and talking here today is getting me thinking more about it, because we focus here at the university so much on supporting the undergraduate students, because, you know, it's new, they're just coming here, and there's a lot of services in terms of in the housing, in the residence halls and things, but I feel like it's so important for graduate students, because it's an entirely different kind of experience, but as Ann mentioned, many of you might also be working or have families, or you've come a long way, you don't have your normal support system, so I think it's even more important to get the message out that the resources are available and encourage people to seek out those resources if needed, because, you know, there isn't that same kind of feeling of, you know, that there's a community there to support you as there is if you're an undergraduate student coming here. So we
We
hope
have-
you'll
Yeah.
take advantage of that.
Every year there's something called Depression Screening Day.
Oh, right.
And last year, a young woman, Asian woman, I can't remember where she was from. I think she was from China. And I happened to be the one to meet with her, and we do a screening. And it was the first time she was telling anybody. And it was, what time of year? It was late.
It's October,
It was
early
in
October.
Yeah.
We do it every year.
Yeah.
Actually, this year it's October 10th. It's called National Depression Screening Day. And we hold screenings up on North Campus in the Chrysler Center by the College of Engineering. And it's very easy to come in, you know, answer a questionnaire, and then you meet with someone like Ann or another social worker who can just talk with you. Again, it's not a full evaluation, but it can help you to think, you know, maybe this is something, like you were asking, how do you know the difference? And if we look at how you answer the screen and say, yeah, you know, maybe you should go and meet with somebody. And they also do the screenings at the psychological clinic, which I mentioned before, which is on Washington Street, and that's listed on this handout too.
Yeah, I'd also like to know that what is the general public opinion of people going to have mental service?
Mm-hmm.
Do they accept this? Because as far as I know, in Taiwan, we don't accept people doing so.
Right.
I think they're psychos.
Right, and that gets to the stigma that we were talking about. And the research that Daniel Eisenberg, who I mentioned, does, looks at stigma, and it was very interesting because among college students especially, most people say, I would not think badly of someone who went to get treatment. I think it's a good thing for someone to go get treatment. But when they ask about themselves, they say, but I wouldn't want to go, which is, you know, you think, how can that be? So I think in general, especially at the University of Michigan, because there is a lot of education about that. The Depression Center does a lot of education, CAPS does. I think students are much more understanding now and know that this is a medical illness, it's okay to get help, but for some reason, even though they know that and they might encourage a friend to go seek help, for themselves it's still hard. But I think in general in the US,
Things have
it's
improved quite
improved, yeah.
quite a bit.
Yeah.
There, in some places, there is also that reaction, but it's so much better. And what's happened over the past 10, 20 years is some very famous people are sharing their stories of depression. And not only famous people, actors and politicians, but even people in the military. These tough men are coming out and saying, I have depression. And that really does help because it impacts every type of person, we know that. So.
But I think here on campus, people are much more open about it now, about talking about it. And we do education with faculty also, so professors letting them know if a student comes to you, here's some accommodations. Oh, also, I don't know if you're aware of the Services for Students with Disabilities office. Have you heard of this office? And again, that's listed here on this flyer. So if you have a diagnosis of depression or anxiety or other issues that might impact your academics, you can register with that office. They will give you a letter that basically says, you can get extra time to take exams. If you need to miss classes, you're allowed to make it up. All different kinds of accommodations that can help you. Because if you had cancer and you had to go to the hospital, the professors would be like, okay, let's figure out a way that you can, either drop an assignment or make it up. And so the same, it needs to be true for mental health issues. So that office can help to support you. And again, some people still don't get it, but I think for the most part, this is a very supportive campus. And, I think you'll find that people are quite understanding and actually see it as a sign of strength. It's a positive thing to get help, because then you'll do better and it's better for everybody. It improves the entire campus. Yeah.
Sorry, may I make sure the definition of term? I mean, depression is a kind of a general part of mental disorder, or depression means just melancholy. I'm sorry, I don't know.
Well, someone can feel depressed, which is kind of melancholy and sad. But we use depression as a bigger category. There's different types of depression,
Okay.
diagnostic categories. So like major depressive disorder.
Okay. So depression would include melancholy or manic depression, or all these kind of some problem of mental.
That's how we're talking about it here.
Okay.
A clinical depression or a depressive disorder.
Okay.
So we use the word depression here to really.
But
Okay.
that's a good point, because, for example, the Depression Center, that's a very broad term, because there's post-traumatic stress disorder, there are anxiety disorders, bipolar disorder, which is manic depression, schizophrenia, which is a very smaller, part of the population. But so we use depression as sort of an umbrella, but we are using it as a clinical term. So as Ann said, some people are like, I'm so depressed. Oh, I feel depressed. And it's just they're feeling badly or they're feeling sad. But again, the clinical depression is the diagnosis after you've had those symptoms for an extended period of time.
Okay.
Does that answer your question? Okay.
Actually, I'm just curious. You mentioned what percentage of the graduate student or medical student that can get depression. So I'm just curious, is there any obvious difference in the possibility of students can get of the students belong to different colleges that can get depression? I noticed that you mentioned about engineering school.
Yeah.
I come from engineering school, so
Yeah.
I'm just curious whether the people from engineering school can easily
Yeah.
get.
I could pull it up, but I have a 10:30 meeting, but we have the slides with all that information, and it is really interesting to look at. So
And I don't think, we're not trying to scare you to be like, oh, I'm here at U of M, everybody has depression, that means I'm going to get depression.
Right.
It's more just to show you that it is somewhat common, and that, to make you realize, I'm not the only one. If you're feeling this way, there are other people struggling too, and and I can get help and feel better. So it's not meant to be like, oh, U of M, look, everybody here has depression, everybody in engineering. It's just more to give you a sense that there are other students that are struggling, and that's why there's a lot of resources here to help. But I will definitely send Nina those slides with the different breakdown of the colleges and the programs.
Could you show us where the international?
Yeah, so if you go to Student Spotlight, do you have to run?
I have a 10:30 meeting, so
Okay.
if you don't mind, I have to go.
Oops.
It was lovely to meet all of you. Good luck with all of you.
That was great. Okay.
All right, so we'll just
okay.
get.
If this works,
All right.
it was working and then it did this. I have
So do you have to enter your email address?
well, it should go to M Wireless and go automatically. I can show them too another day.
Okay.
I didn't realize.
But it's on that main student page, it says Student Spotlight. And then you click on that and it has, the very bottom one is international students.
All right.
So have you gone through do they do a graduate student orientation? No? There's no orientation? Huh. That's interesting.
It is, yeah.
Yeah. But at Rackham Graduate School, there's a woman named Natalie Bartolacci who works in the Student Services Office. She has a lot of information about mental health support resources as well. And Rackham is really trying to make that something that they're very proactive about addressing. So they've got a health fair that they run, giving students information about different resources. So there's a lot of different points of access, so where you might feel comfortable reaching out to get support. Okay, there we go.
Okay.
So if you go down,
So it was
Student
students,
Spotlight,
student spotlights.
and then you go down, and there's the international students. Yay. So if you go down, you'll just see, so there's information about the International Center. Yeah. Academic pressures. It's got different links. And what we also did here, we link to a lot of different U of M websites because we didn't want to recreate the wheel. There's a lot of good information out there. Again, we just wanted to have one place you could go to then find all of that different information. So there's an international student group that CAPS offers. That link is not working right now because they're getting them set up. They're getting the schedule for the
Okay.
fall ready. So, but you can click there, and it's, again, that's a group where you can meet other students, discuss different challenges. That was the time that was held in the spring term, so they'll update that information for the fall term.
That's great.
Yeah. Yep, 4 to 5 p.m. Yeah. So,
Yeah.
any last questions? Or?
Are law students especially prone to come?
Law students, you saw that, yeah.
They have a special.
They have a special one. Well, we actually did that because somebody, there's a dean at the law school who's very interested in mental health issues, and every different group, law students are worried about revealing if they're seeking treatment or getting treatment because they're afraid they're going to have to say that when they take the bar exam. So, and I think every profession has concerns like that, and so we did that spotlight to try to help educate law students about what resources are available, what really the rules are in terms of having to disclose if you've received mental health treatment. Because often students, that's another barrier. They won't go and get the treatment because they're afraid it will impact their career somehow. So just trying to dispel some of those myths, I guess, to encourage people to seek help.
Do they affect their career?
Does that,
Does going to psychologist or being having mental disorders really affect their career?
well, that's what they were concerned about. And so this dean was saying, no, you don't have to disclose. You can if you want to, but you don't have to disclose any kinds of medical treatment that you've received. There's privacy, regulations around that. So he didn't want that to discourage people from going to seek help. Because obviously, it's much better to get help and then you're well. And if you say, oh, I better not do that, it might hurt my career, but then you're unhealthy, that hurts your career too. So better to get the help. Well, you guys are wonderful. Thank you for having me today. Thank you, Nina.
Thank you
Yeah,
so much.
sure. And, just help yourself to different brochures and
Yeah.
flyers if you like, and I will definitely send you those slides.
Okay, that
And there was
sounds
another
great.
question. About comparing the different colleges, the international colleges. Yeah. All right. If possible. Yeah, I'll see.
Yeah.
That's a great question.
Also, in the screen, in Athens, they put the information comparing. It says that Harvard is the most stressful university for students, of course, and MIT, I think Yale, and they put 5 universities. Michigan University doesn't
Okay.
isn't in the 5 universities. And they put the main causes of stress or anxiety was a problem, financial problems, academic problems, and to be so
You can get up and go grab some brochures if you'd like.
And if anybody wants one of these notebooks to take, I've got a few. I can